Hi everyone, how's everybody doing? So are you ready to live to 100? Yes. Let me reframe that. How about, are you ready to live well until 100 or beyond 100? That's what we're going to talk about today. So it's well-known fact that this generation is living longer than the last generation did, but I'm not sure if we're living better. So let's see what's going on there and what we can do to fix. Do I have to point here? Okay. All right. So we all know that world's population is aging. The age of death is much higher now compared to before. Aging is also the largest risk factor for chronic diseases. And until recently, we thought about diabetes, hypertension, hyperlipidemia being modifiable risk factors and age being a non-modifiable risk factor. But friends, no more. Age is a modifiable risk factor now, which we are going to talk about. We are also getting more and more aware of the toxins we are exposed to on a day-to-day basis, and we will talk about strategies as to what we need to do to prevent those exposures, and if we are exposed, what can we do to mitigate the harmful risks from there. And then we are going to talk about how, as a medical community, we as physicians need to move from being reactive to being preventative and proactive. And myself being one of the biggest examples, I started with being a spine interventionalist. As I used to do spine procedures and minimally invasive surgeries, I realized that probably I'm not doing a big service to people by putting in hardware or steroids in their body. What about having strategies to prevent those conditions from coming on, so I didn't have to do any of those. So it's brought me a full circle, and as I have started looking at ways in which we can avoid degeneration or sustain and prevent degeneration to advance, it's taken me on this journey of regenerative and longevity medicine. And today is all about that. I think I have to do a better job at that. There? Okay, thank you. So this is a graph that actually shows you exactly how the population is changing. So if you look at what it is currently, we are beyond 2018, of course, but prior to that, if you look at the number of people over age of 65 and people under the age of 5, the younger population was much higher. In 2018, those points intersected. In 2050, the number of people over age of 65 will be double the number of people under age of 5. And I believe in 2100, it will be 5 times over. So clearly, we are getting older and we are having more chronic diseases. Okay. All right, so here is a graph again showing how that age pattern has shifted and how the peak is much greater now in terms of age. And with that, there are physiological changes that happen in our body, such as epigenetic alteration. For those of us who know about gene mutations, our genes continue to mutate and shift because of exposures that we have, because of our lifestyle factors, because of toxins we get exposed to, because of lifestyle behaviors and so much more. So there's a constant evolution. We may be born with the best genes or the worst genes, but it's not going to stay constant as we grow older. So obviously there are genetic mutations, there are cellular changes, molecular changes at chemical levels, there's mitochondrial dysregulation, and so much more that determines how we are going to behave in terms of medical issues for years to come. And so with the ages shifting, we are seeing increase in arthritis, heart disease, cancer, dementia, you name it, right? I mean, all of us, if you think about when you were young, how many people around you really had cancers or had autoimmune conditions? But literally now, you see every other person has some kind of autoimmune disorder or is diagnosed with heart disease or stroke or has cardiovascular event and so on. So definitely there is something going on there. All right, I'm tempted to bring this laptop over here. Did it shift? Okay, so here are the toxins very commonly that we are exposed to, and this just shows all the types of things that you can be possibly exposed to and what that does in terms of altering your genes and creating mutations. Meg, if we can just move on to the next slide, please. Okay, so how many of you like golfing? All right, there you go. And this is not new news, I hope, to many, but it has been shown and published numerous publications that people living close to golf, greens or golfing are at increased risk of Parkinson's. And that has to do with the pesticides that are needed to maintain the greens, and so many more risks like that, right? So, and this is a common lifestyle thing that we all deal with, something that we have to be aware of, and something that we should do the biomarkers to test what our risk factors are and take precautions to be able to mitigate that from coming, right? Similarly, there are other awareness issues that we need to talk about, and that's what we'll do next. So let's talk about microplastics for a second. How many of you have heard of microplastics? Great. And you also then are aware that it can actually clog your blood vessels in the brain and heart and create strokes and heart attacks. And let me ask you, do you think it's a common exposure that we get on a day-to-day basis every day? Yeah? Yeah. Can anybody tell me how many microplastic particles do we have in like a plastic straw, for example, that we use for sipping? Take a guess, anybody?
1 million.
Yeah, drop it down a bit, but you're close, you're close. Okay, tell me about the bottled water, and here's one. Give me a rough estimate of how many plastic particles are in this water bottle. You're getting there, yes. So huge numbers, obviously, and then imagine some of these are nanoparticles and some of them are very toxic to our bodies and something that we need to watch out for. So again, microplastics has gained a lot of popularity, been published a lot, and something that we all need to be aware of. Meg, next slide, please. And this is just this was published in the New York Post, and this just shows you what kind of changes we can see externally with microplastics exposure, PFA exposure. So with low exposure, you can see skin changes, irritant, autoimmune reactions, but then with high exposure or chronic exposure of a period of time, you can see a skin change like that. So if the external appearance, the skin looks like this, you can only imagine what your internal organs are doing. So I can't overstate the importance of the awareness and then prevention of those exposures. There are lots of stuff in your home that you're, that have PFAs, including your own garments and things like that that you could be exposed to. So please keep an eye out. And this is a topic and discussion like that will take another hour, so we're not going to go there. But this is just to raise awareness as to why regenerative and longevity medicine is important. And you heard a lot of that in the previous speaker's talk, so you are aware and you are now well tuned with what's out there. Let's move on to the next. Thank you. So just bringing home the point that aging and these exposures can cause a lot of different things like genomic instability. I talked to you about gene mutations. I talked to you about cellular alterations, chemical and molecular changes at the cellular level. It can also cause, a mitochondrial dysfunction. Mitochondria in the body is one of their most important organs, produces ATP, the energy molecules, and all of this can really impact how your stem cells function, how your body regenerates or repairs ongoing damage that's going on. And one note on telomere attrition that was in the previous slide. So who can tell me what telomeres are? Exactly. So telomeres are the caps of the chromosomes. We are all born with good amount of telomeres. And as the cell divides, as we age, those telomeres keep shortening. They're often compared to the ends of the shoestrings, and they decrease in size as the cell divides. And that has been shown to be a marker of your longevity. Knowing how many kilodaltons of telomeres are left, you can predict how long you're going to live. And that has been linked to a lot of lifestyle behavior patterns and regenerative and longevity medicine measures that we take, and that is something also that destabilizes with those toxin exposures and lifestyle factors. So that just brings home the point of all the awareness that you need to have. So our goal with longevity medicine is to make sure that not only do we create a health span that is fulfilling, but also create something called lifespan, health span, which is creating healthy living for all the years we live. Now, given all the science that we have at our disposal, we may not have the capacity to increase the number of years you live, but we certainly have the capacity of creating those years to be fulfilling, functional, and healthy. So that's what we will talk about today. Let's move on, right? So at Reve, what we have done is set up Longevity and Regenerative Medicine Institute, which focuses on your overall wellness. My background is in spine and sports medicine. As I started doing stem cells and PRP research, I realized that these therapies, although very powerful for people, did not have the same effect in different individuals, even with the same condition. And the reason behind that was the host factors, the host environment really greatly determine the outcomes, because if somebody had high hemoglobin A1C or altered thyroid levels, they did not respond to the stem cells and PRP like the other people would, like normalized patterns would. So that then brought home the point of how important it is to be able to control your overall protoplasm, your overall physiological state to have the best responses possible. So what we have set up at Reve is a series of diagnostic tests that we can do with biomarker panels that can actually help you understand your risk factors for heart disease, stroke, dementia, metabolic problems, diabetes. Now, this day and age, the proteins that get spilled in your blood for any of these conditions predate 10 to 20 years from when these conditions are going to come on. So now you have the capability of finding out what your risks are for these conditions. And I think it is on us, if we don't take advantage of them and we don't take advantage of the facts we know to prevent these conditions. So we have a list of things that we go through that I'll tell you about, where we do functional assessments, we do biomarker testing, and then we can combine that with imaging studies, telomere lengths, DNA methylation tests, which clock your age, not only your biological age, but also of different organs, and then put together precise programs that are customized to you and your health to not only give you the best lifespan, but also the best health span. Let's move on to the next slide. So these are some of the biomarkers and panels that we use for a variety of things. We do gene mapping, we do cardiovascular mapping, we'll do metabolic mapping, brain health mapping, neurological mapping. And then there are other metabolism-based mappings and so on that we do. And we do have a platform that we offer our patients, which actually gives you the database of all these biomarkers, as well as it overlays the imaging study findings. And then it overlays that with your own lifestyle factors and creates a protocol for you to go on with, and then allows you to track the outcomes at the back end once these interventions have been done to see what kind of responses you have from these therapies. These are some of the genetic markers we use in our practice for longevity, and then oncology and repair markers. We can actually detect cancers way ahead of time now and take steps to prevent, especially if you have risk factors. Let's move on to the next slide. And then there are neurodegenerative markers. As we know, dementia is up and up. Even in the younger population, we are seeing various forms of dementias, and there are proteins now that you can do pre-testing with to see your risks and take measures with measures like NAD or glutathione to be able to prevent the neurodegenerative conditions to come on. And then we do VO2 max for people that allows you to find out your lung capacity. It will do some metabolic markers for you, and also is indicative of your lifespan and health span. Grip strength, muscle span. How many of you have heard of muscle span? Muscle span has been linked to health span now. The agility of your muscle, the resilience of your muscle, the strength of your muscle now is directly connected to how long you're going to live. That is why there's so much focus on resistance training, HIIT type of exercises that builds your muscle, that directly overlays with the telomere length and the life that you're going to lead in a healthy and a functional fashion. Heart rate variability, gait speed, sit, stand test, all of these are standard with our evaluation, along with systemic biomarkers, like I mentioned, for cardiovascular, neurovascular, neurodegenerative conditions, and even telomere length. Let's move to the next. These are clocks that we use. These are DNA methylation clocks that will actually clock your individual organs in terms of how they're aging. So your, physiological age may be 65, but your biological age may be 50, and your brain age may be 45 or 65. Your liver and kidneys, heart, everything can be aged individually. And as we do different therapies, you can actually, landmark these ages individually in addition to your physiological and biological age. So this just talks about different types of clocks and aging mechanisms that we have that would help you identify how well your body is doing and what specific therapies can be customized to those organ systems that are aging faster and decelerating faster than your normal age. Then there are advanced imaging techniques that can be done that will identify myocardial perfusion, which is how your heart is functioning, how much blood flow you have in the heart muscles, and how your ejection fraction is, and do you have any risk of heart attacks and things like that. So there is a lot of detailed, intricate studies we can do with imaging studies that can be overlaid with the biomarkers to give you the correct risk factors and correct aging clocks for your individual organs. Let's move on to the next slide, Meg. Sorry for this being a slightly hazy slide. I didn't realize it will overlay like this. But this is the longevity data that we have built at Reve. By the way, Reve means the dream in French. And the goal in the practice is to be able to have your dream body, your dream life, and your dream health span. So, we want you to feel good, be good, look good, and just have a great health span. So it starts with, of course, the foundational aspects of good lifestyle factors, right? Sleep, optimization, stress optimization, working out, weight control, and so on. But then it moves on to micronutrient testing and treatments with IV infusions for micronutrients, macronutrients, proteins that might be missing from your body. As we age, over the age of 40, we lose some of the basic essential elements that we should be having in our body. For example, we lose NAD in our body. That is responsible for cellular repair, DNA repair, and also for mitochondria to produce ATP. And rejuvenating the body with those infusions is absolutely critical to be able to get to where you need to be physiologically and to feel the way you should be feeling at whatever age you're in. So there are nutritional therapies can be done. Hormone is a big, big factor. I see often it being not tested in the mainstream medicine. I have mentioned this example to a lot of people where I had a woman who came to me with uncontrolled hyperlipidemia. So she was on Lipitor at a very high dose, and no matter what medication was thrown at her and how much she exercised and controlled her diet, the LDL would just not come down. And it was just a matter of her hormone not being replaced. So we did a thorough workup. We evaluated her, with all of the functional tests we were talking about, did her hormone panel, and lo and behold, her estrogen level was really low. And no matter what she would have done, had that estrogen not been replaced to physiological levels, she would have battled the LDL elevation, no matter what dose of Lipitor she would have been on. And just switching to her to transdermal estrogen preparation actually nicely brought down the LDL levels. She was able to decrease the Lipitor, and she did really well. So is the power of retaining your physiology. And as we get older, we got to make sure that we come back to our baseline physiology and restore whatever is missing from our body. And if you were to take one message home today, regenerative and longevity medicine is all about restoring your normal physiology naturally. It's not to make you somebody else and not to pump growth hormone in your body to make you bigger or heavier. It's about what can we do in minimal possible way, minimally invasive way, to get you back to baseline. And that's what this lecture is about. That's what this talk is about. So of course we do weight management. Weight management is an important component of controlling your metabolic health, your cardiovascular health, your brain health. We do that with GLP, GIPs and personalized programs that we'll talk about. Then we do PRP. How many of you know what PRP is? Show of hands. Okay, so PRP is platelet-rich plasma, which is your own body's growth factors, and can be used for a variety of things. So essentially what it means is we draw the blood, spin it in the centrifuge, and inject that into a variety of structures depending on what the needs are. We do it for joint degeneration. We do it for disc degeneration. We do it for microneedling with facial for collagen rejuvenation. You can do it for hair restoration and variety of other things. And it is one of the safest things you can get because it's your own body's growth factors which you need, which diminish in course of time and need to be replenished in the areas that you're damaged in. So even as I stand here, I'm having micro tears in my body. My body is constantly degenerating, having micro traumas, which we all do, right? Sitting, standing, doing things that we do as humans. And normally, our platelets rush to that area, release the growth factors, and start the healing mechanism. But sometimes these micro traumas and micro tears are large that our body cannot naturally heal. That's where things like PRP or stem cells come into play, because we just need to bring larger portion of those healing factors to the area for it to heal. That's why your rotator cuff tear becomes chronic or becomes painful and needs that PRP injection, or your ACL tear or meniscal tear needs some intervention instead of just physical therapy or just corticosteroid injection. Then RPA actually does need, we'll go back to the previous slide. RPA is regenerative protein array, which is a group of growth factors, proteins, and mRNA that now can be used for a variety of indications that we do, which includes autoimmune conditions. I think there is a slide on that, so we'll talk more about that, but literally can be given through an IV and doesn't have to be a localized painful injection. It's just an IV push that actually can solve a lot of challenges and is gaining a lot of popularity. I actually was interviewed in one of the news channels about this because this is new to the market and is showing a lot of promise. Although it has gone through investigational studies, so it's not new in the terms of you undergoing clinical trial, but it is out for clinical application and can be really a useful tool for all of us. Sleep and stress management are really important because they have shown to significantly change how your body responds to stress and other chronic diseases. So health optimization is at the foundational and ground level. Let's move to the next slide. Then IV infusion therapies can be done with a variety of things that are essentially lacking from your body and need to be replenished to bring back the physiology that we talked about, to get you back to baseline. NAD infusion is very, very popular in our clinics just because it causes DNA repair, it causes mitochondrial rejuvenation, it produces more ATP, which are those energy molecules that you need to be able to function like you normally should. So IV infusion is about that. Let's move to the next slide. Hormone therapies. So after we reach menopause and andropause, we are losing estrogen, we are losing testosterone, often gets overlooked. How many of you have brain fog or just overall fatigue? I'd be surprised if half of us didn't raise hands here. Come on. Yeah, absolutely, we do, right? And we do because we are not in our normal physiology. We need to get tested for hormone levels, right? And it is as essential as having that insulin in our body or having those proteins in our body that we need.